Hello, this is Howard Hillstrom, Senior Director of the Leon Root Motion Analysis Laboratory at the Hospital for Special Surgery. Today's presentation is entitled In Vitro Pedicle Screw Placement Using Robotic-Assisted Navigation is Superior in Accuracy, Precision, and Breach Rates to Freehand and CT-Guided Navigation Techniques. By way of introduction, pedicle screw accuracy, precision, and breach rates can be assessed by computed tomography and expert visual assessment. However, these techniques are subject to bias and error, they are time-consuming, and are limiting in the granularity of data they provide. This study utilizes a novel computer vision algorithm to automatically align CT scans of preoperative planned and postoperative placed pedicle screws, assessing the accuracy, precision, and systemic error of robotic navigation versus freehand and freehand navigation. 3 cadavers were utilized from ages 66 to 82. Robotic-assisted navigation and freehand navigation screws were placed by one surgeon, while freehand screws were placed by a second surgeon. Both surgeons were highly experienced. Screws were placed bilaterally from T1 to L5. Automated segmentation and computer vision techniques aligned each preoperative vertebra and its postoperative counterpart using preoperative and postoperative CT scans. Tip, tail, and mid-pedicle screw positions of placed screws were identified and compared to planned screw positions along 3 axes. By way of results, 87 screws were placed in 3 cadavers, 24 robotic-assisted, 29 freehand navigation, and 34 freehand. 15 screws were skipped due to registration difficulties. Robotic-assisted navigation screw placement was more accurate than freehand for tip, medial lateral, mid-pedicle medial lateral, and angular deviation parameters. Robotic-assisted navigation screw placement was more precise than both freehand navigation and navigation for the majority of relevant parameters. Mean absolute error further supports the advantages of robotic-assisted navigation screw placement. No robotic-assisted navigation or freehand navigation screws were breached, while 1 freehand was breached. Table 1 shows a numerical summary of the tail, mid-pedicle, and tip results for systemic error, precision, 2 times the standard deviation, and accuracy, mean absolute error, for these 3 techniques. Note that all of the p-values in bold are significant, and therefore those numerical values are real differences. As shown in Figure 1, accuracy and precision of pedicle screw placement at the mid-pedicle position. Note that the precision or variability in the data for robotic navigation is shown in the left-hand target diagram, and a substantially larger precision is shown in the central target diagram, which is for freehand navigation. And then finally, on the right-hand side is the precision for freehand. It should be noted that the mean absolute error is smallest for robotic navigation as well. Automated algorithmic determination of pedicle screw accuracy, precision, and breach rates provides an objective assessment of pedicle screw placement. In our study, robotic-assisted navigation demonstrated the best accuracy and precision in the majority of measured parameters. Further studies will apply this computer vision protocol in real time during in vivo surgeries.